Thank you all for joining us this morning. We know it's a really, really busy time of year, as we were just hearing about from folks. We have a kind of busy but also flexible agenda today, and that we want to spend most of our time really hearing from folks about the draft policy recommendations, SAC policy recommendations that I sent out Tuesday. And then we'll hear a little bit from Sarah Kenny, who's joining us a little later, about a survey that she and the Vermont Family Network are working on about specialized childcare. But let's start with intros. We're a small group, and we have a new person joining us today. So let's go ahead and do introductions, name and role and where you sit. And I'll start and I'll hand it off to Beth, and then we'll just kind of popcorn around if that's all right. So I'm Anna Brulette, as all of you know at this point. I support the work of this committee and other committees at BBF, and I'm our team's policy and program director.
Good morning, Beth Trzanski, Deputy Director at BBF. It's great to see you all this morning. Why don't we go Becca, Amy, and Sheila.
Hi, all. I'm Beck Webb. I'm a Universal Pre-K coordinator down across midline of the state for 10 SUs.
I think it's me, Amy Johnson. I'm the director of the Parent-Child Center of Northwestern Counseling and Support Services.
Good morning, everybody. I'm Sheila Duranlo. I'm the Director of Programs for the Child Development Division.
Awesome, thank you. Jess, Jill, Cynthia, you want to make an introduction?
Hi, everyone. I'm happy to join this group. I'm Jess Hyman. I'm the Associate Director of Statewide Housing Advocacy Programs at CBOEO, and I'm here to lend a housing lens to this important work, and I'm looking forward to learning more and catching up and to the conversation today. Thank you.
Jill Larson at the Family Place in Norwich. I'm the Specialized Childcare Coordinator.
Good morning, everyone. I'm Cynthia Green. I am the Farm to Early Childhood Partnership Coordinator with Shelburne Farms in Vermont Feed. And apologies, I don't have a camera this morning.
Awesome to have you with us. Thank you. Hey, Kaya, you want to make an intro?
Sure. Good morning, everyone.
Maybe
Renee. Good morning, everybody. I am Kaya Gancouli. I am the Director of Trauma Prevention and Resilience Development for the state of Vermont.
Awesome. Renee or Jen? I think Sarah and Robin are those we haven't heard from.
I can come off. Good morning, everyone. Renee Kelly, Director of the Vermont Head Start Collaboration Office within the Child Development Division. Apologies for doing some side work with Becca in the chat while I see her, just trying to be as efficient as possible. Good to be with you all this morning, and apologies for also being off camera, but yes, managing childcare, no childcare, crazy schedules. So I'll try to participate as much as I can today.
I can go. I'm Sarah Wallace-Broder. I'm the Interim Executive Director at Vermont Family Network, and I will be off camera while I finish my breakfast. We'll rejoin, but you don't need to see me eat.
Great. I'm Robin Friedner-McGuire with RFM Strategies. I'm contracted with VFN to support them in some of their advocacy work, and I'm also a parent advocate, so I usually wear two hats in these meetings. I too am eating my breakfast, so I'm going to spare you the view.
I am thirding that because my breakfast, I just have to grab it out of the microwave and I'll be eating too.
Hi, I'm Jen. I am a parent rep on this committee, and I co-chair the Families and Communities Committee.
Thank you, Jen, and thank you to the rest of the folks as well. And no worries about going off camera and eating your breakfast or taking care of other things. We're certainly understanding of all of that. So as I said, we're gonna spend a lot of time this morning kind of walking through the policy recommendations, and really want to hear your feedback and ideas about how to strengthen them, particularly related to kind of the work that this committee has been holding and focusing on, but the rest of the slate as well. And before I share my screen and kind of walk through those, I'm going to ask that Beth give us a little bit of background about the process to develop these SAC recommendations this year, and kind of how it differs a little bit this year from past years, and what the strategy was behind that.
Awesome. Thanks, Hannah. Policy recommendations, this process, BBF has really kind of been evolving or has evolved based on feedback on what is needed. But first and foremost, the policy recommendations are really a tool work, which in over a 450 person kind of network of those of you who are tuned in here at the Child Outcomes Accountability Team, other VCAP committees, the regional councils, really that kind of broader network. And so what we do is annually kind of take stock about what are the conversations that have been happening at our tables over the last year or so, and what are the kind of key opportunities to message where policy change is needed in the next year. So that policy change could be administrative. So it could be message to kind of our state policy or state agency leaders. It could also be legislative. So we see both types of policy change and recommendations in what we'll share with you this morning. The policy recommendations really are in draft form. We're just kind of going through a tour of this initial draft with VCAP committees and other leaders to get input. I mean, really the concepts have emerged and been elevated through the network. Now we're kind of sharing this draft back with you. We'll continue to make edits and then eventually bring recommendations to the State Advisory Council for their endorsement. And that will happen usually around October. And when they are finalized, they will be printed in the State of Vermont's Children, which is shared with the legislature in January. At that point, or even earlier, there's a handoff often to our advocacy partners, to legislators who say, these are things that I want to run with, and they can be shifted into kind of proposed bills or implemented into practice change in the administration. Of course, not everything is picked up, but we saw several things picked up and moved into action in the last year. And so this is really an opportunity. I think the difference between what policy recommendations are and like what the Vermont Early Childhood Action Plan is that the VCAP is kind of multi-year strategy. Really, we want to encompass the whole early childhood system from prenatal through age 8. When we're talking policy recommendations, we're talking about actionable change in the next year. We are cautious. While there are many things that are important, we don't necessarily want it to be kind of the whole kitchen sink, right? We want to be able to elevate key points that we feel like are critical and what we're seeing are impacting children and families and the system, so that that can be messaged to the people who are in positions to make change. So that's a little bit about the policy recommendations kind of as a tool and how they're used. How they've been developed is this year, the BBF policy team served as the kind of synthesizers and writers of this first draft, with input going and seeking input from key partners that either have been around our tables, or in some cases, we felt like we needed additional information from key partners. Housing is a great example, and we'll talk at length about that. So it's an attempt to synthesize what we're hearing, identify what's actionable. And at this point today, we'll walk through those policy recommendations in draft form. Would love to hear kind of what resonates with you, and also where you feel like change might be needed.
Great. Thank you, Beth. Any questions or comments about any of that in the process thus far?
Is the VBF policy group an internal group?
Yes, yeah. Beth is just referring to kind of our team of 4. So Beth, myself, Dora, and Morgan as the policy team.
Thanks.
Mhm.
Hey folks, can you hear me? It's Rena.
We can.
Okay, I want to come on camera, but before we dive into the draft, I was curious about, you guys have heard me say this before, but I feel a little bit like an old timer. I was curious about going back to the early childhood action plan to remember what goal 1 was. Because I feel like when I saw these recommendations, they felt like goal 3, which was about CIS and services, equal and opportunities for children and families. And because I was part of writing the early childhood action plan, I put in all the goal 1 was about people come into the pediatric office, they get home visited when they're pregnant, and then we really try to bolster the efforts within the healthcare system for a healthy start. So I don't want to be that person because there's been a lot of great work with CIS, but I did want to remember what goal 1 set forth to do as we think about policy recommendations.
I think that's a great point, Brina. I think, and as we walk through these, folks are welcome to express where we might move things around. We kind of grappled as a policy team with where certain recommendations should land. I think there's many that could fall under a bucket or 2 or even 3, depending on kind of what lens you're thinking about the recommendation through. So admittedly, there's definitely like a subjective nature to a lot of that. I think that this committee, at least recently, has been thinking about goal 1, all children have a healthy start, in like a little bit more of a holistic lens. So thinking a lot about housing and access to nutrition and all sorts of things. But if there are other pieces that need to come through more strongly under the recommendations in goal 1, we would certainly be welcome to that feedback.
Yeah, Brina, I really appreciate your point. I think the other thing to consider, and those of us who are kind of VCAP geeks, right, who look at it a little bit more than everyone else, we actually use the same indicators for goal 1 and goal 3. So there's a very clear alignment between all children have a healthy start and what do they actually need to do that, right? So I think when we are organizing things, it is mushy a little bit, right? Because we are trying to build an integrated system, but that's a little bit of, so I think what we see is kind of a little bit more of the basic needs, and the child development stuff, frankly, could go in either category.
Totally. Well, and please know that the social needs of families is definitely, well, I get it. I mean, we were thinking about more of sort of where our children, they're in their pregnancy care, they're in their homes, and then in their pediatric health care, and in those settings, how do we address housing? How do we address food? So it's all right here for us. I also wanted to just note, and you guys know this more than any, representation on groups drives engagement, or engagement drives representation. So health doesn't show up at these things very well, especially people who deliver health care, because pediatricians can't come to a meeting at 9 in the morning. And I've had long talks with Matt Levin about it too. He says, well, we don't have any policy stuff about Medicaid coverage for pregnant people because those people didn't come to our alliance meetings. And so there's just a little bit of a rub here about how do we get voice from all sectors without So I guess I'm just trying to hold that up a little bit today, and I promise to stop talking.
No, I think all your points are well taken. And I think we have very similar conversations in the Families and Communities Committee about who can and cannot show up to meetings and how that impacts the work that we're doing. So really appreciate those comments. Any other things to share or questions before I share my screen and we start to walk through these? Okay. Let's see. All right, is everyone seeing the recommendations document? Awesome.
Yes. Yep.
Thank you. All right, so I think what we'll do is walk through these kind of goal by goal, and then between each goal we'll discuss, because I know it's a lot to respond to, and I'm understanding if folks didn't have time to review this in the past couple of days. So this year we have kind of structured these by goal. The hope being that we can present a little bit more of our initial intent was to have a shorter, kind of clearer list of recommendations. It is of course grown as we've gathered feedback and talked to various groups. But the hope is kind of that the goals offer an organizational principle that makes these a little bit more digestible. So under goal 1, we have a recommendation related to care coordination. So fund the critical elements of coordination beyond case management to best serve the whole child and family across service sectors: early Head Start, Dolce, CIS, and Vermont Blueprint for Health programs being kind of the examples of programs that offer care coordination. Some recommendations, sub recommendations under that are make the critical elements of CIS other than case management that provide service coordination, reimbursable services through Medicaid, and then a kind of TBD bullet related to a Head Start recommendation that we are kind of actively seeking feedback on. I didn't see Renee's full comment there, but she has been helping us kind of field some potential feedback from Head Start directors there, but we would be open to any other comments on those as well. And then this next bullet about housing really came out of conversations that this group had, I would say probably 2 meetings ago, when we were reviewing the system asset gap analysis results. We had a really great conversation where housing was really central, and we felt as though it was coming through stronger than some of the other basic needs priorities for this group and others, and therefore kind of built out this set of recommendations. So these read: respond to the housing crisis that is pervasive in our communities and address and work to reduce the trauma of homelessness by, and then some sub goals or sub recommendations: adopting a just cause eviction ordinance and investing in housing programs and resources that expand availability and promote affordability in Vermont's rental and real estate markets, such as expanding the family supportive housing program and protecting mobile home communities by investing in infrastructure repair and maintenance, a little bit of a mouthful, and investing in trauma-informed shelters, transitional housing, and transportation resources that ensure children are able to attend school in their home districts, if preferred, in order to support families during challenging transitions with their housing status. So as I said, I think I'll pause there and we'll kind of take feedback and or questions for this first set of recommendations. I see Kate's hand up. I just want to make one more point. So these recommendations are really kind of where we see COAT kind of holding and taking charge here related to these recommendations. And therefore, I think out of all of them, it's most important that the committee feels itself and its priorities reflected within goal 1. That being said, as Brina and others have rightfully pointed out, there is a lot of overlap. But I think it's important that these really get discussed. So I'll go to Kea and then Becca.
So one of the things I've been trying to do is switching some of the language around trauma. If you could change trauma informed to trauma responsive, because what's happening is people will do one trauma class and say, I'm trauma informed, and I know what I need to know. I'm trying to change the mindset of we need to be responding.
That's great feedback and an
Thanks.
easy change to make. So I appreciate it. We can certainly look at that. Anything else, Kaya?
That's it. I actually have seen some of this before because I met with.
Yes. Yes, we appreciated your feedback on these pieces. All right, Becca, and then I'll go to Jess. Becca, I can't hear you. I don't know if others can. It doesn't look like you're muted, but. We still can't hear you. I don't know if it's your headphones. I'll go to Jess and then we'll come back to you.
Thanks, Anna. After first reading this, I had sent some recommendations for some more specificity in policy, but I really heard what you were saying earlier about not wanting this to be the kitchen sink of policy and really focusing on targets that are germane to this group. And so I'm not going to bring up those things right now unless we get deeper into this discussion, but there are a few things that I would really recommend as part of the context. In just in the language and how this policy is introduced. And that would be to add, so when you say respond to the housing crisis that's pervasive in our communities, I would add increase housing opportunity. And then address and work to reduce the trauma of homelessness, just because that's a really important piece of access. And then in the piece, I would also separate out adopting the just cause eviction ordinance from the investing in housing programs and resources. Those are pretty distinct things that I think each have their own weight. And one very important word to add is investing in housing programs and resources that expand availability and promote affordability and equity in Vermont's rental and real estate markets. So I would recommend those context words be added, and then the further policies can come later. Thank you.
That's all really helpful. Thank you, Jess. All right, Becca, any luck with your audio? Oh no, we still can't hear you. I'm sorry. Feel free to add your comments to the chat as you try to troubleshoot. I'm sorry you're having trouble with it. Brina, I'll go back to you.
Hi, folks. And I really appreciate. I think the inclination is to sort of wordsmith. That's we don't really want to do, and I'm really curious about CIS providers' reaction to this, but I don't think it's make critical elements of CIS service. We don't want to imply that all of care coordination, there's something, I think we could talk about this in a way that CIS is holding some of the coordination, but maybe we want to talk about it more about sectors, like where is the coordination in through integrated services, where is it through the healthcare settings, and where is it maybe in early care environments? Because I also if you want to start mentioning blueprint, you're going to have to add one care. You have to be careful about all this because one care actually funds Dulce, so there's some awkwardness in this list. And you guys know that once you start IEing, someone's left out. So let's just think together about what, I think this is an awesome bullet. So, but I'd like it to be structured in a way that's maybe not listing, maybe just talking about the coordination that goes on in the early childhood integrated system, which is CIS, but also in medical homes, maybe child care, early care environments. I wonder what other people think about that.
That's great. Thank you, Brina. I think we struggle with that as well and wanted to essentially make it clear what we meant by care or service coordination and kind of played around linguistically too with what to use there. And therefore did list programs, but I appreciate your comment about perhaps that not being the right route to go. I wonder if anybody, before I get to folks with their hands raised, I wonder if anyone has a reaction or comments about that.
I would just agree with that. I think that when I look at this, I think where are parent-child centers, where are DAs, and then I'm sure everybody like has their own list. I think it might make sense to put a definition of care coordination, service coordination in here so that we know what we're talking about. It's probably a lot easier. Maybe finding something in the Medicaid manual. Just some thoughts.
Yeah, I agree with that. The bullet is too limiting. It really should be whole population and services that any family might need to have a healthy start. And when you start as everything that Brina said, I think the language just needs to be broader and more basic for all families and what they might need from any program. And I think then you capture all of these individual programs.
I just had a clarifying question about that, because when I read the first bullet, so this is not in contradiction of anything Brina or Sheila said, but when I read the first bullet, it says to best serve the whole child and family across service sectors. And so then I would expect what's in parentheses not to be programs, but service sectors like, health, early childhood education. So I don't know if that's correct, but to me, it would be more like types of services as we think of them in sectors. And then, yeah, I think the first open point could be broader. But maybe since BBF has done some specific work with the BBF data brief around CIS, particularly calling out the value of care coordination or service coordination, that CIS might be highlighted in some way there, maybe linking with the collaborative data work that BBF and CIS have done.
Thank you, Anne. Yeah, I think that I'll get to other folks in a moment. There's definitely some wordsmithing for us to do here. I think to your point, the across service sectors, that is our attempt to kind of vaguely describe service or care coordination, and not well, rather than we're not so much. The parenthetical statement there is supposed to be programs that do connect, that do that care and service coordination, rather than being related to the cross service sectors. So there's definitely some wordsmithing to do. And perhaps we will consider getting rid of the listicle as well. I want to go to folks who have other comments related to this language and care coordination, and then we'll take broader comments. I see Robin's hand and Brina's hand again. Are you both wanting to speak to this bullet?
Yeah, I think my comment's more general, which is that maybe you would have the answer to this to the policy team is, are people going to understand what you mean by critical elements of coordination beyond case management? I feel like I'm floating around in this space a lot. I don't know what that means. And so I feel like from a messaging standpoint, then we're starting way far behind. And so I'm just curious about that piece, or if there's a way to address that.
Absolutely, point taken. I think we have some room to grow here in terms of how we are describing care coordination to a much broader audience, including legislators. Like, I don't think anybody is going to know what this means, to your point. So we'll work on this, and this is a piece too that we will probably ask this team to provide feedback on via email or through other avenues as we work on it. So Thank you, Robin. Brina, I'm going to go back to you. Do you have more thoughts on these bullets?
Well, I wanted to make sure. Thanks, Robin. I love seeing you all, by the way. Hi, Robin. Amy made a great point. There is a definition of care coordination and its elements in our payment systems, which would be of interest to pull up. It might be a little wonky, but we could play with it. The distinction between service coordination and the care coordination that goes on with a family, right? So integrated services is to get the services together and create a care coordinator, in a one plan and agree. So we just want to be careful we're not conflating the two. And I love what Ann said. We definitely want to highlight CIS as a way to bring the coordination of services in the care coordination that occurs with a family. You see, it's just a little nuance. I wonder if this section would benefit from kind of a story. So basically, the reason I oversimplify early childhood in my brain is because we only have 5,000, sometimes 5,200 babies born every year, right? So the reason I like goal 1 being this up, I know that BVF commits to pregnancy care, prenatal up to 8, but this goal was really about you have pregnant people and then you come on the earth, and we could get that right so easily with 5,000 people. It's not that complicated, right? So I wonder if we want to think about, in the space where we engage new families, we would like adequate funding for the coordination that goes on in that setting. So, and that's sort of the sector piece that Anne was alluding to, because you don't want to miss any sectors, but you also don't want to overstate that brand new babies are in every part of our community in terms of its service provision, right? There's something very, I don't know, something about this goal for me that's about the start, not the middle or the so okay, I'll stop. Did I say I was going to stop talking? I apologize.
No need to apologize. All really helpful comments. All right, I know that Sheila had her hand up and I believe it went down, but I want to make sure you don't have anything else to add, Sheila, before we move on.
Thank you, Anna. No, I completely agree with Brina. I think that naming these, I think this is just way too focused, and it needs to be broader. It needs to be about the start of life, and what supports and services do families need, and then make sure they're properly funded, regardless of where they sit.
Okay, great. Thank you. And then I want to also circle back to Becca quickly. I saw that she left and then rejoined us, and I wonder if her audio is now working.
I can try it. Does that work?
It does.
Oh, yay. I think it was the switching back and forth between headphones for a minute. So I don't know that it belongs here, but I'm going to throw it out and people can tell me where it belongs. What we're seeing in the pre-K world is a bunch of children who are disconnected from their medical homes and not receiving medical, dental, early childhood mental health. When they move from one family they've been living with, either to a foster family and enter foster care, or move between those places. And I worry about that disconnect, right, to go along with Brina's point about where are the points where we can grab kids.
So are you seeing that, just so I understand, Becca, as a related to a issue of care or service coordination, or are you seeing that as a concrete and separate recommendation?
I think both. I think where I see it is an access to care around, if we're talking about health care and healthcare access for these little guys. So I don't actually know where we want to put it, or if we want to put it, but I think it's important to have as a statement that's out there.
Mm-hmm. Great. All right, Renee, I see your hand.
Yeah, two things. Just following up, I think, on what Becca was saying. I do interpret that as a need for better case management, but it's for a particular population, right? Like that's kind of calling out that they're like, this is important for all kids, and it's really important for a certain subset of kids who are already extremely vulnerable. So just my reaction to that, Becca, is I agree. I don't see it as separate. I just see it as a more defined targeted population that we need to take into account. My question is really broad here, not having this document up and being able to scroll to the bottom. Where is mental health supports coming up in these recommendations? Because I think that that still is important, and couldn't remember seeing it in any other spot, and didn't know, while these things are important, housing, yes, and I know we don't want to make it the whole kitchen sink, but it would also feel a little bit odd to me if in the current state we're not making any recommendations specifically around the mental health supports or the social emotional needs of kids and families.
Yes, very much hear you there. Based on kind of what we were hearing from this group and others, focused on the mental health workforce as the key recommendations this year related to mental health. So you'll see those, I believe, in goal 3. But if there is a clear mental health like service delivery element that is missing here, we're open to hearing about it. But yes, we really focused on the workforce piece this year. Renee, to answer your question. All right, Robin, and then Brina, and then I'm going to on to goal.
Go ahead, Robin. I can't see everybody.
Yeah, and I'm so sorry. I was trying to keep my mouth shut. So thank you for listening to all of this. I'm not quite sure how to articulate this, but I think one of the things that's sort of nagging at me is kind of the equity here that doesn't feel articulated strongly enough. And I think we assume that stuff that's sort of cooked in. But I worry, like I've always worried about the statement of all children have a strong start, because really the folks who are most in need are children who are not a part of the dominant culture. And we really don't quite understand those needs very well. And I think and maybe this is someplace else, but I do wonder about representation in the funding of these programs. Maybe that's in the workforce piece. I have to think about it a little bit more. I feel like I'm bringing a problem up that I don't have a solution to, but I just, like, as a parent, like, I just don't feel like it concerns me that I don't see that in here as, you know, a parent of Black trans kids, for example, or queer parent. Like, it feels woefully missing to me. And I don't quite know how to solve that. So sorry, but I'd like to see that strengthened in those throughout all of it.
Sorry to jump in, but Robin, what we could do, and I agree with you, I thought of a solution when you were talking, which is in this first statement where we're talking about, or any of these statements, we can, I think we should or could put in a reference to best serve the whole child and family with special attention to issues of diversity, equity, and inclusion across service sectors. And I think you can do something similar with a lot of these to really explicitly call it out.
Thank you, Kaya and Robin. And again, please don't apologize. We wanted, and this is a conversation I had with Renee as well, we want equity to shine through and be woven through all of these, and same goes for like parent leadership at the core of this work. So if it's not coming through, and if it feels like a really obvious gap, I welcome that feedback, and we will work on the language to make sure that that is not the case. So really appreciate that recommendation. Also acknowledge that it can be challenging to come up with a singular solution to that. So thank you, Kaya, for kind of some advice on language. We'll play around with it. And again, we'll circulate another draft for folks to react to. Brina, and then I'm gonna kind of move us along to goal 2 because we do want to hear your feedback on other pieces.
Well, and I think Robin articulated it so well. You would grab and connect beautifully with the healthcare sector if this document said healthcare has historically not been safe or culturally informed, just some basically calling out that healthcare is working on this, and that we as a group of people who are talking about pregnancy and new families, that we would like to support and continue to advance that work, or something, just because it's such a, there's been this misnomer in Vermont in particular that healthcare is destigmatizing and that it's very safe, equitable place, and that's not true. And so the pediatricians in particular are acknowledging that there's been race-based medicine, there has been a complete misunderstanding of what access really means. And so I'm sort of proud of the fact people are in the reckoning without any solutions. So I think people would like the document to acknowledge the health space around equity and how much work there needs to be done. And then the other thing I was going to wonder about with you all, again, because we're not in consensus that this is about the beginning. I think people are still wondering about, completely understandable, about mental health care, maybe for children who are 2 or 4 or 8, but this document would do very well to represent the dyadic need that parental mental health is what impacts the Brandy baby. And it is surprisingly difficult in our life through policy, payment, system to work in a dyad. We are ridiculous in the way that we manage our language, the way we talk about things, the way we pay for things. And it's become quite interesting to pediatric healthcare. Like, this is why we love Dulce so much. All pediatricians know that there's some stuff going on with families that's not quite at the surface of the well visit for the baby. And so the energy, the right human to build the trust, to have the conversation with parents about what they're experiencing before it impacts the baby would be that's the brightest future. Because what happens in healthcare is you're allowed to call in services once the baby has been identified as having a concern, and it's never a surprise to a pediatrician when a developmental screen comes back abnormal, because we were not adequately addressing what we knew was occurring without adequate support to address it. Okay. So dyadic work would be cool in policy because other states are actually much further along than Vermont on how you can pay for services for parents in the context of a new baby. Why wouldn't you? Except it's because they're 2 completely separate systems, at least in healthcare.
Excellent points, as per usual, Brina. I am going to move us along just for the sake of time, but if any of that resonated with folks and they really want to see pieces of that incorporated, we welcome your comments in the chat or via email or at other points. I think the parental mental health piece is really important. I think that came up again in past conversations related in this committee. And is why we kind of focused on the workforce piece, as we were the mental health workforce piece, that is, because we were hearing from folks that was kind of the key barrier to receiving services was the lack of mental health providers during this time. But that's definitely something that we're actively interested in exploring. We're hoping to have a little bit more data in this year's State of Vermont's Children related to family and parents' ability to access mental health services, as we've recognized that in the past when we are talking about family and early childhood mental health, it's really early childhood mental health that we are focusing on or have data related to. So anyway, lots of other conversations to have there, but appreciate your comments. I'm going to scroll down to goal 2. I also recognize with the time, we're probably not going to get through all of these today, and just want to quickly say, again, we are more than happy to take your feedback via email, but if you'd like to discuss these further verbally with us, please get in touch with myself or Beth, and we can set up separate meetings to have those conversations. So goal 2, families and communities play a leading role in children's well-being. I will say that the Families and Communities Committee is really kind of holding these, and we've yet to hear their feedback on these pieces, but are presenting them to them in early September. So I imagine some of the language here is very much subject to change. But the first of these is require each legislatively mandated board/committee/decision-making body making policy and program decisions with implications for the well-being of families with young children to have at least one parent representative with lived experience. The representative's lived experience should be as current as possible and should support their ability to weigh in regarding relevant age ranges of children and/or experience with relevant systems or services. The second of these is provide commensurate compensation for families participating in engagement, leadership, or feedback opportunities in order to recognize and honor the time and expertise that parents and caregivers contribute. So the first recommendation, folks probably recognize a similar recommendation was in last year's slate of recommendations. We've tweaked the language a little bit based on some initial feedback from a couple of groups, trying to really hone in on the importance of recent and lived experiences. So someone who is been a parent of a young child experiencing the program or service or whatever the relevant decision at hand relates to fairly recently, rather than someone who was a parent of a young child 20 years ago, is kind of the intention there. There's perhaps some language changes to make that more clear. But I'm going to open the floor again for feedback on these.
Anna, can I pop in? I didn't raise my hand. Sorry, Renee. Not to wordsmith, but I question whether the guidance whether the recommendation should say require each blah, 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 or whether the emphasis should be on recruitment, like, can we actually make a recommendation that requires something, or are we making a recommendation that practices that organizations look at their practices?
That's a good question. I think it's a question of like who this recommendation is for. So the way I heard you just describe that, it's broader. It's about like all organizations, including the legislature as a institution, thinking about representation. Whereas I think the way it's currently written, we're thinking solely about the legislature. But I do think, as perhaps you're alluding to, it's like it's been a challenge in the past to really like bring accountability to this, or to institutionalize it in some way, or require it. Like how like we've heard from folks.
Right, parents should be at the table. I'm not arguing that.
Oh no, I know that.
I just wonder about is there a credibility gap in saying you must versus our recommendation is that you look at practices.
Mm-hmm. Okay, great. Yeah, I think are continuing to explore with folks who have more expertise in this area too. If there isn't like a given template that the legislature is using, which is kind of what we're hearing from Leg Council, there isn't a given template for like the piece around like an advisory committee or a board, then how are we making this a requirement regardless is kind of where my comments were coming from. So we're open to kind of shifting this if folks have other thoughts. Lots of hands up. I'm going to go Renee and then Sarah. Wallace Broder, and then Sarah Kenny.
Oh, okay. Yeah, so, quickly responding to Becca's point, I completely hear you. I would say, yes, we don't want to make this recommendation for programs. Like, we actually want to make this recommendation for the legislatures. So if they're, defining like a new opioid coordination council or a new housing council, that they really are intentional about including families with lived experience. So, and I just wonder if, again, not to wordsmith, but if we clean up and just left it that, each legislatively mandated body, maybe that's a little bit more clear cut. But just my overall I'll be curious to see the families and communities reaction. And I think I saw Jen on earlier. So I don't know if she has initial thoughts, but I would love to hear them. I will just say, first glance at this seemed really surface engagement to me. Like, I still love seeing this requirement around including family voice. I think that is important, and I'm sad that hasn't gained more traction. I'll be interested in thinking about how we could do that. And maybe, Becca, to your point, it's a both and, although the recommendation is that the legislature really ensure that any bodies include parents. Maybe there's some work that we can be doing, another strategy, if you will, with programs about that awareness and understanding of the importance of family engagement and how that has a positive impact on kids and families. So yeah, I guess I'm struggling with this a little bit, because even if these things came true and each legislatively mandated board had families with lived experience, and we were providing compensation, I personally don't see that as really moving the needle in terms of how programs are working with families and kind of including them in CQI. And so I don't have a solution like Robin. So like, I feel like I might be presenting something without an idea about how to solve it. But I just feel like there might be something missing here, is my initial reaction.
Thank you, Renee. All right, both Sarahs.
Yeah, this is kind of piggybacking on what's already been said. I get a little concerned when you say at least one, because then I think a lot of people, a lot of committees will say, yeah, we have the token parent, and often their voice is not fully heard. And we hear from parents that they feel like they are not really having an impact on those committees. So I think it really needs to be clearly defined. And I think that I would say more than one. I think if you're going to put a number, I think one is not enough. And I just am worried that their voices will not truly be heard. And there's other pieces of that often a parent or caregiver representative, if they're the only one trying to have a voice, they can feel very vulnerable and alone in that on some of these. So I think we need to, I don't know, I just worry about that.
Excellent. Yeah, I very much hear you, and I appreciate Robin's comment in the chat too, related to creating a culture that of course goes beyond, like you're saying, Sarah, like a token parent representative. And that is certainly like our intention and where we're coming from as well. I think it's hard kind of thinking back to how we contextualize how we think about these recommendations. It's hard to articulate that in a recommendation that doesn't feel like a soft like value statement and feels like a concrete, like actionable and like a policy recommendation that we can track and monitor progress over time. So I appreciate all these comments, and I kind of encourage folks to think about how we articulate them through those goals. Okay, I'm going to go to Sarah, and then I really want to hear from Jen on these, and then Robin, and then I'm going to give us probably 5 minutes. I'm going to eat into our next segment a little bit, 5 minutes to look at goal 3.
Anna, and I'm very sorry y'all for missing what sounds like it was a very rich first part of this meeting. I have a standing conflict with these meetings first thing Thursday morning, but I'm happy to be here now. I totally agree with everything everyone is saying, and I do think that there's probably room in that, maybe even in the second bullet or somewhere in there, to build in a little more language around something about doing the work necessary to actually create a welcoming environment for parent representatives. I don't know, I don't have the capacity to wordsmith right now, but I think that makes sense. And I also want to strongly recommend that you keep in the requirement language, just because this is a recommendation to the legislature. And I think, to what you were just saying, Anna, like, we want something that is specific, that they can implement, and that we can track. And I think that if it's just a like, it would be terrific if families felt welcomed in every place where legislators or advisory committees to the legislature are meeting. That's nice, but it doesn't, I think they need a directive to follow. So I like the require language, and I agree that there's room to sort of wordsmith it to make it more clear that, and maybe even embed some resources for folks in the legislature who are looking at implementing language like this, around where to look for that framework for folks.
Excellent. Thanks, Sarah. Jen?
Hi, I am going to keep my video off. I have a tick-borne illness and I'm having a pretty intense outbreak or whatever these last couple of days. So I'm going to try and get through this without sneezing. But first off, I want to say I agree with what Sarah Wallace-Brodeur said. It just being a parent at a table, I feel that. And I really can't, as a parent, like, represent all parents in Vermont. And an idea that has been going around, as I mentioned, I'm the co-chair of the Families and Communities Committee for the past few years. And we've been talking a lot about building a leadership team. And if that is something that, you know, within that committee, and if that is something that we're able to do, I would love to see this recommendation go from just having one parent with lived experience at each table to have all these bodies, legislatively mandated bodies, use the Families and Communities Committee, or come to the Families and Communities Committee, which is already an established committee of families and parents and caregivers. And specifically, if we had a leadership team to, you know, put in some extra time and work to maybe review documents or review recommendations or review whatever the legislators, you know, putting out, because it is intimidating to kind of sit at tables for parents, or maybe to have, you know, it would be the same parent at every single table, which also doesn't seem very fair. So yeah, that's just something that I'm kind of planning to talk about with the Families and Communities Committee soon, and we will be reviewing this this goal in our next meeting. So I'd love to hear what kind of my committee has to say, and we'll definitely bring notes back. Yeah, Anna and I both will bring notes back to everyone here.
Thank you, Jen. I really love that idea. All right, Robin, and then, as I said, going to quickly pivot for about 5 minutes to hear folks' kind of quick reactions on goal 3. And then if everyone can send us feedback on goal 4 in other ways, that would be great.
Yeah, I mean, I think that what's missing here is getting at the culture at these tables. And I wonder if there's a way to put in some language in there around, I don't want to just say welcoming, because that's not what we're talking about. It's like the respect and dignity and representation of families, not there as token storytellers, but as strategists at the table who are informing the goals. And so I think that there needs to be a recognition that these boards generally don't lay the table for that. I mean, just think about how much BBF has worked so hard for years to try to make that happen. But there are frameworks out there. And so I wish there was a recommendation around some of those frameworks. Also, there are incredible family organizations here in the state that these boards should be going to and inviting in for these conversations. And I would like to see something like that. I mean, there's multiple organizations who engage with families all the time, and they're not being invited into these tables. I mean, they want to have staff time and they don't compensate them for their staff time, even though the staff is serving families throughout the state. That doesn't work, right? So thinking about how you partner with family organizations, so then you don't put the pressure on just one family member at the table to represent all of the family. So I'd like to see more of an expression of utilizing the resources, the robust resources that we have here, which also for me gets to the culture issue that we have at these tables with the engagement of families and parents.
Thank you, Robin. Really, really well said. And thank you too to all of the comments and ideas and some kind of live wordsmithing happening in the chat as well. We're certainly going to capture all of this, and it'll be lots of it will be reflected in the next draft you all see. All right, we have probably about 5 minutes before I want to pivot to our next part of the agenda. So I'm not gonna read through these, but I'll give folks a minute to take a peek at the recommendations under goal 3. All children and families have access to high quality opportunities to meet their needs. As I mentioned earlier, this is kind of where you see recommendations related to the workforce. So we have an early childhood education workforce recommendation and some sub recommendations. We have a STARS revision work recommendation related to kind of recommitting to best practices. And then we have a mental health workforce recommendation and a couple of kind of sub recommendations related to that. So I'm sure lots to kind of digest and react to, but want to give folks a chance to share any feedback verbally for about 5 minutes, and then I'm going to cut us off. But again, really want to hear folks' feedback. So please feel free to get in touch in other ways. Becca, hopefully again with good audio.
Let's hope. So what I would love in bullet 2 with investing in proven professional development, I think the other piece for me, it's the financial, it's the passion and the will, right? In terms of investing. But I think that the other piece I would suggest adding into this bullet would be a really comprehensive, well-connected, I don't know how you say that, right? But we need to move away from this system of here's a piecemeal this, here's a piecemeal that. And I know that's work that's going on, but I wonder if there's a way to recognize it in this in terms of emphasizing a priority.
Okay, excellent. So something around like the coordination and strategy rather than a piecemeal approach.
Exactly. Mm-hmm. Well-rounded, integrated.
Yeah. Excellent. All righty. Sarah Kenny.
I just stuck something in the chat about the opportunity to embed some more language here around diversifying the early education workforce too, or creating a workforce that more represents the growing diversity of young children. But I also, I'm wondering about access and affordability for childcare here, which I totally agree that the workforce is a huge driver of that and a huge component, but I wonder about a bullet here that also talks about the lack of access for families, especially families who have kids who require any kind of support to be in childcare, and affordability for families. So just throwing that.
Thank you, Sarah. Renee.
Yeah, my brain split in 2 directions with this one. So first, I want to respond to, to Becca, to your point. I love that about that coordinated system, and just want to highlight like the looming shadow of the systems analysis here, right? And often what we're seeing in terms of these environments and the way that PD happens kind of currently in a piecemeal way. There's like the Northern Light system, which childcare often goes to, but then there's this whole separate set of PD for UPK programs. So I agree that, you know, language around the coordination of those systems is important. And I think the systems analysis has an impact on that recommendation. So recognizing things are still moving there. And then to your point, Sarah, around the access piece, and I think this goes back to that, like, and I really hate this term, that targeted universalism, because it seems like, how could you be any more redundant? I've shared that with folks before, but Robin, it's kind of what you were talking about earlier. It's like, how do we want there to be universal components where all children have what they need, but we also need to pay special attention to those populations and to folks who have been, you know, marginalized in some way. So in terms of that, that access piece, I think there is something there around access, and it also looms to that, again, systems analysis, part B and part C, you know, getting kids the supports that they need to survive, like to thrive, because what certainly we've seen since COVID within the Head Start world is really this disconnect around settings and, you know, particularly with Part B services and where Part B services can be delivered or where they're not being delivered. So thinking about, you know, that population of children who have special needs and need that additional support, like that's more of a push for coordination between these two systems, because right now, I will say in the Head Start world, what we're seeing is there are children with disabilities who do not have full access because of the funding between the Part B systems and how, you know, one-on-ones, frankly, are paid for or not paid for and where they can go. So just wanted to elevate that. Hold on, please. Sorry, little helper. Thank you.
No worries. Thank you, Renee. All right, Robin, I still see your hand up. I'm not sure if it's from the previous time. Okay. No worries. Any final comments before I unfortunately have to stop this really great conversation? We really appreciate everybody's feedback and engagement. Okay, it sounds like that's about it. As I said, if you have comments that we didn't get to today, please feel free to send them along, including on goal 4, which I recognize we didn't have time for. And we will, you know, as Beth mentioned, in terms of our process, we still have a number of other committees that we are kind of doing the tour with these. But after kind of that round of feedback, we will be, you know, drafting a new version of these that reflects a lot of folks' comments and concerns. And we'll circulate that again for another round of feedback with this group before they make their way to the SAC. So please feel free to get in touch. Happy to chat with you via email or in another fashion. So thank you. I'm going to turn things over to Sarah and perhaps some of the VFN people as well to talk about their specialized childcare survey.
Thanks, Anna. It's the Sarah's show this morning. Hi, y'all. I think I know most of you, but I'm Sarah Kinney. I'm the Chief Policy Officer at Let's Grow Kids. And thanks, Anna, for letting us come talk to this group for a bit this morning about a project that Vermont Family Network and we have been working on together. As folks know, Let's Grow Kids is on a mission to transform childcare in Vermont by 2025. And 2023 is the year that we are coming in to follow up on the goals that were set in Act 45 last year by the legislature, that no family spends more than 10% of their income on childcare and that early childhood educators are compensated on par with their colleagues in other professions. And so as we are sort of building out all the details that underlie those two big goals and working with legislators and many, many stakeholders, including a lot of folks here, to figure out what does that all look like and what does the system look like that supports that. We are trying very hard to make sure that we are centering voices of families, and specifically families that haven't historically had access to these policy conversations in developing that legislation that'll be moving forward next year. So Let's Grow Kids has been doing a bunch of work, both collecting information from families of color in a couple different ways, and then working with the Family Network to think about how are we specifically collecting information from families of children with disabilities and special health needs. And just to be clear, we're not talking about like the whole scope of services available for children and families, although that is critically important work. And we have been talking with the authors of the PIES report from last year, the UVM researchers who did that work, and Robin has been supporting a lot of those conversations too. And we're really trying to hone in specifically as this childcare legislation is advancing next year, what are the pieces specific to childcare programs that we need to be embedding in legislation to try to ensure that kids with disabilities and special health needs have access to childcare programs, that what are the pieces that we need to leverage through childcare programs specifically to support kids to thrive in those environments. So as a sort of first step in that, or maybe it's not the first step, but as we are working on this, we really want to collect information from families. And so Sarah's going to talk a little bit, the other Sarah, about the survey and focus group work that we've been working on together.
Yeah, so we've had several meetings throughout the summer with between VFN and Let's Grow Kids. We've had participation from 2 of our family support consultants who have experience working with families in early childhood and who also have experienced the child care system themselves. And we've worked, so the meetings are about developing the survey to try to make sure we're capturing ways where we can see where the childcare system might be working, but also where the challenges are for families who have children with disabilities and special health needs, and to give opportunities for those families to express that. So we have sent out the survey through, we have 2 closed Facebook pages as well as on our Facebook page. We're hoping that people in this meeting and who are connected to the early childhood communities will also be willing to share this survey. We want to get as much feedback from families as we can. For families who complete the survey and want to share their information, they can be entered to win a $50 Visa gift card. They'll be their names will be put into a drawing. We also ask if they would like to participate in 2 different focus groups that we're going to help organize and facilitate with Let's Grow Kids that will be happening in September or October. We have to figure out the dates of when those are. So one of the focus groups is going to be around specialized childcare, and again, kind of focusing on are there things that are working? What are the challenges, barriers that families are facing? And what supports might childcares need who are specialized childcares? And then we also are, the other focus group is going to be around children that are being sent home or kicked out of childcare because of behavioral challenges and social emotional needs. And again, what families are experiencing with that and what supports might childcares need, where are the challenges, and also do families have a good understanding about what their child's rights are in those situations. So again, we're hoping that people will be willing to share this survey. I think Sarah's going to be connecting with people. We have it on our Facebook page, so if people want to go on to VFN's Facebook page and share it, that's a quick, fast way to do it. And yeah, we've gotten some good responses so far. But we'd like to hear from more families. And we also want to make sure that we are hearing from families across Vermont. So we don't want to just have it be concentrated in certain regions in Vermont. We want to really make sure we're getting good representation throughout Vermont.
Thanks, Sarah. Just from the first share from the Family Network's Facebook pages, we've had 82 responses so far, which is amazing, and also really shows that families are eager to share their experiences right now. My coworker just did a quick glance at the initial responses yesterday, and we've got 11 of 14 counties represented so far, and there's a good distribution across like families of infants, toddlers, and preschoolers, and children with medical, behavioral, mental health, physical, and developmental needs have all responded to the survey so far. So that's great, and we would love to get even more families able to take this. And then there's another link to express interest in the focus groups, which is also embedded at the end of the survey. I dropped the link to the survey in the chat, and there's the first page has like introductory language. We would love all of your help getting this out to families that you work with, or to people who can get it out to families. And I'm not sure the best way to do that. I don't know, Anna, if you would be able to forward something to folks that has the introductory language and the links for people to put into email, like newsletters or whatever. And again, as Sarah said, a really easy way to help elevate it on social media is to just like and share the posts from the Family Network. Do you want to call on people, Anna, or should I? I don't know. I don't know the usual protocols here.
Feel free to, Sarah, and I can just send me anything you want included in our next note to folks with the meetings and with the meeting minutes and everything, and we can make that happen.
Awesome. Thanks. Renee, I saw you were going to go first. I'm not sure. Or Becca.
Yeah, just a couple of questions. One, I'm curious about how you all have engaged with the CIS state team or the CIS regions, particularly the specialized childcare coordinators. I do see Jill Larson on. Hey, Jill. Yeah. And then second, wondering what will you do with this information? Like, I think it's akin to the family conversation and ensuring that, you know, the information and the data that were collected is used in some way. So I'm curious if you could talk a little bit more about, you know, how you've engaged, you know, in the planning, and then also what are you thinking in terms of when you have this information, what will you do with it?
Yeah, thanks, Renee. Two great questions. The answer to the first is this is our first step of sort of like getting out beyond just conversations between the Family Network and Let's Grow Kids. So as we were making a list of all the people we wanted to talk to about this next steps, it was like, oh, I know where they all are meeting. It's at this table. So we're really eager to connect with people about how best to get this survey out there. And we are going to be using the results internally at Let's Grow Kids and with the group of stakeholders who are helping to create the legislation for next year to inform the draft of the bill that'll be introduced in the legislature. So it's specifically going to inform, are there pieces, either financial resources or other components specific to childcare programs that we can embed into the legislation that's going to be introduced next year to help move these pieces forward. And we built this work off of the Families of Color Needs Assessment that we also have out there that we've partnered with a bunch of different other organizations to create. And that work we're keeping really internal because we've told people that we're not going to be sort of sharing their stories more broadly through that work, specifically through our advisory committee. With this, we've just sort of put it out there in the world that this is a survey that where we're collecting information that will be informing legislation. So we don't have a plan to like publish it per se, although I do think it would be helpful. We are thinking about putting together sort of a brief of what information we gleaned through these pieces, partly to help legislative advocacy, because I'm really committed to making sure that as legislators are talking about transformative childcare legislation next year, that they are centering especially these two frames of reference in terms of what families need from childcare, families of color, and families of with children with disabilities and special health needs. So we're thinking about ways to sort of consolidate information gleaned from these to put forward to legislators as a part of this. Becca, go ahead. I'm going to glance at the chat.
I have two quick questions, and I may have missed them. The jets just went overhead while you were doing the majority of your talking.
They were with me right before that too, so I may have missed some things as well.
Welcome to living in the Burlington area. One, is this just going to specialized care programs? Is that your target or everybody?
We're wanting to circulate it as broadly as we can, because we're not necessarily assuming that families have that their children even have been able to access childcare or that they're in specifically specialized childcare programs. So we'd love to get it up. We want to hear from families sort of across that spectrum of what their experiences have been. Sarah, were you going to add something to that?
Yeah, I was going to say it's some of the questions in the survey are, is your child in childcare? And if not, why? Would you like your child to be in childcare? What are the reasons why maybe your child is not? And we also know that there are families who have children with disabilities and special health needs who are unable to, who may not be in a specialized childcare. So it's not just going to specialized childcare. We want to get as many families who have a child with a disability or special health need to respond to this, who have, they have to be under 6. So. It's not for a family with a 12-year-old to respond. We're really looking at the early childhood years.
The next round of F-35s is about to come over my house, but I did want to respond to Amy's question about translation. We don't currently have the survey translated into other languages. We do have resources available to do that. What we've found with the Families of Color Needs Assessment is that just having our survey interpreted into other languages does not actually capture, it's not actually accessible to a lot of families who don't read English as their primary language. What we have been doing is doing sort of almost mini focus groups where we're about to, with interpreters available to help walk people through the survey, which is, we've heard from many of our partners is a much better approach. So we have resources available to help folks who need alternative language access or who don't have written language and need other ways to complete the survey. Some of those folks we would probably refer to the focus groups, but we do have resources if folks know families who would have valuable information for us but wouldn't be able to access a written English SurveyMonkey tool. And we're always happy to hear from people with other ideas about how to do that, because you all are the experts in working with family. And Renee had a question around how this intersects with the PIES report. This actually grew out of our conversations with the authors of the PIES report, as we were thinking about how to, because they're UVM researchers, they couldn't make specific legislative recommendations in the report. So we had some informal conversations with them about and Robin and other folks from the Family Network were part of those around so if you had been able to say whatever you wanted to, what would you have recommended? And part of it was we need more resources, and there's not sort of universal agreement on what are the specific tools that we need for childcare programs to support kids with disabilities and special health needs to thrive in those environments. So another next step would be to find out right now in this moment from families, what do they need? What do their children need to be able to succeed, and then sort of move from there. So we're trying to figure out what can we glean that we can include in legislation right now, and then certainly hoping that whatever we learn will be incorporated into other conversations happening elsewhere too. Jill, I think you had your hand up. Sorry.
Yeah, so this is kind of my world.
Yes, exactly. I know, I was hoping to get connected to you.
The first comment I would have is that childcares need to have access to funds year round, that just having SAG grants certain times during the year is very inconvenient, where, not all children are programmed to have their problems at certain times. And programs have no resources to tap into, and those times where they're at a loss of what to do. And that's when the expelling them comes into action. And then is there any aspect of this that you're looking at the child cares and how to best serve kids with their disabilities?
You mean specifically talking to childcare programs about it?
Yeah, and to see what they need as far as help and accommodating children. And I think adding in the mental health piece of this and how that's a special health need as well is important.
Absolutely. Thanks, Jill. Yes, we are talking to childcare programs, but I'm also really interested in folks here and folks working with like the specialized childcare coordinators and others and thinking about, is there I think there is information out there already from childcare programs about what they need. So making sure that we have access to all of that information and then facilitating other opportunities totally makes sense. Yeah.
Can I speak?
Oh, I'm sorry, Robin. Yes. Your hand is up. Go for it.
No, I just wanted to, I'm speaking totally as a parent right now. I'm so thrilled that you guys are doing this work with the Family Network. I think that this is an example of how families can inform a process. And I know a lot of times we go through programs to survey families, and I think that's important. But I think a lot of families are disaffected by our programs, right? And so they don't feel, they're not as connected to those programs, so they're not filling out the surveys that we're then making policies based off of. And I think the fact that you had such a high number of families respond to it so quickly is such an impressive and important indicator of that. And I hope that as a group, as we move forward, that we think about these types of partnerships and ways of engaging families that maybe are outside of the programs, you know, the different programs sort of touch. For example, I've sat in many meetings as a parent with a child with significant mental health issues in early childhood where directors are talking about things that feel wildly different from my family experience and from other families who I know. And I think part of that is a lot of the research almost sort of reinforces what we already know as directors. So I guess I just want to say hats off to both Sarahs and the internal work that Let's Grow Kids has done to kind of get to this point. I know it's under the wire, but I'm really appreciative for the representation and the work that's going into this.
Thanks, Robin. And you helped to create a lot of this too, so thanks to you.
Oh.
Facilitate a lot of this.
You made me forget my point. Oh, so this is a little bit of an aside, and I'll keep it really brief, but I wanted to say that someone, I think it was Renee, wrote in the chat about the timing of surveys and coordination around this, and this is not criticism of anybody because everybody wants input from families. So I just wanted to say I wrote recently to Dora Levinson about this, and I'm looking to Beth working across committees here, you know, maybe the Data and Evaluation Committee can have this on their agenda at some point because it seems to me like BBF could have a coordinating role in if people were able to tell BBF, you know, when they have a survey in the works and what their suggested timing might be. And it might be a place where people doing surveys could go to see what other surveys are going out, you know, what's going out today, what's going out, you know, and what vehicles are being used, because I think a lot of surveys are coming to families with young children. You know, I know the Strong Families, CIS Strong Families Vermont has a survey going out. Renee mentioned the BBF Families and Communities, this stuff from Let's Go Kid, and that's probably just a slice.
All right. Thank you, Anne, for those comments, and thank you to the team of Sarah's for your presentation. I recognize we're at time, but I am gonna briefly plug the survey that folks have mentioned in the chat and that Anne just mentioned. I do think I see your point, Anne, around survey fatigue and survey redundancy, but do want to plug this survey that the Families and Communities Committee and Jen and her co-chair Sarah Morrison have done a really great job getting out to the fields. We have a team of parent ambassadors that Renee also, I think, alluded to in the chat that are currently fielding this survey for us, promoting it in their communities. And we ask that you all do the same. I'll put the link in the chat, but there's also been a variety of communications from our team on social media and via email, and we'll continue to promote it for the next month and a half or so. And it's a general family early childhood needs assessment. So we're interested in hearing from parents and guardians of young children under the age of 9. And we are really excited to have it out there. It's a survey that, as this group has heard in the past, was primarily developed and drafted by our committee and our team of parents. So we're really proud of it, very excited to have it out there, very excited to share the results with you all, and would appreciate everyone promoting it. So with that, I think we'll come to a close. We really thank you all for your engagement and feedback this morning on the policy recommendations, and please be on the lookout for more info about those, and feel free to get in touch if you have thoughts you didn't get a chance to share this morning. Thank you all. Take care.